Public health is incredibly personal to me. It really gave me a language for extremely important and consistent elements of my life experience. I was sitting in a course in, I think, maybe my second semester freshman year, and a professor threw up this slide on the screen, and it talked about cycles that families move through, dynamics and unhealthy behaviors in mental and social dynamics. And it just hit me like a bus. I had never been offered a framework for a life that I often felt like needed to be kept hidden. When I saw this on the screen, it just kind of broke me open, because I was thinking, oh, if this is here and all these people in this room know about this too, then we can talk about it and we can look for solutions. The possibilities to me started to feel endless. I started to see the world in more of a systemic way. Public health gave me the understanding, and I started to develop the confidence and the voice to really make decisions about my own life and my own environment. It's almost impossible to really describe how fully that changed my life forever. And I am so grateful for the chance to see the world more clearly, to have had the opportunity to work with others in spaces like sexual health, reproductive health, body autonomy, youth development, now choosing a vaccine that could save one's life and family. All of these things mean so much to me, because it really just never leaves me what it felt like to have the light switched on for me. So if I could do any small bit of that for another person, I'll continue to do that work forever.
That was today's guest, Hannah Stuart Lathan. Hello and welcome everybody to Making Public Health Personal. This podcast is brought to you by the CUNY Graduate School of Public Health and Health Policy in New York City. I'm your host, Laura Meoli-Ferrigon from the Office of Online Learning here at CUNY SPH. Each episode of Making Public Health Personal focuses on an aspect of health and social justice that affects our daily lives. We'll learn from expert faculty, researchers, alumni, and students on how public health policy, advocacy, and practices can benefit our ever-evolving community and our world. You don't have to work in healthcare or have a PhD to understand these topics. We're going to break them down for you and give you practical tips to make a difference. In today's episode, we'll be hearing about the personal journey of our 2021 valedictorian, Hannah Stuart Lathan. She is the program manager of Convince USA and the New York Vaccine Literacy Campaign, which supports community-based efforts to increase vaccine uptake through education and communication. She's also a researcher who leads programmatic activities and events and works to identify and mitigate concerns about vaccination. We'll talk about some of her research and efforts around vaccination, and we'll also find out about her journey to get through her Master's of Public Health degree program here at CUNY SPH and onto a successful career. I'm so glad to be talking with you today, Hannah. Thank you for joining the podcast.
Thanks for having me. I'm really happy to be here.
So you were valedictorian here at CUNY SPH in 2021. Tell us about your journey to get here and how you started your educational career.
I guess really my educational career, I have to say, starts with a turn of events in high school in South Carolina, where I'm from. There is a free public arts boarding school, which many tend to find surprising. And I was accepted there and attended a conservatory program for 2 years. That really shifted the trajectory, I think, I otherwise would have been on. I was from a very small town and a fairly insular community. And so this exposure to that education and to people from other parts of even the state alone was very important to my growth and to me personally. And so from there, I stayed in state and went to the University of South Carolina for my undergraduate bachelor's degree and studied public health and journalism there. Mm-hmm. When I finished with my bachelor's degree, I first moved to New York and was working kind of in a variety of fields. Largely, I was copy editing, and I also worked as a tutor and did some temp work and just kind of the thing that people often do when they first come to the city. and was really looking to put down roots here. And so in the process of doing that, about maybe a year into being in the city, I got hired at New Settlement Apartments in the Bronx. They have an incredible girls program there that I came on to teach health-based girls issues classes initially. So we were exploring health issues that were important to the girls who were all in middle or high school, and using a public health lens and supporting them in that through writing, acting, performance art. And so my work really was rooted in that youth development from a public health lens. And from there, I started to teach other health areas as well, and even worked some in English language arts and arts education. I started to teach sex education eventually at the girls program, along with financial literacy and other youth development work. Then from there, I worked with Community Healthcare Network for about 4 years as a sexual health educator and counselor, and managed a staff of peer health educators as well. And that was what I started to do as I began the master's program as well in community health. So I was very rooted in a youth development lens of sexual health education and counseling for in total about 7 years in the city.
Wow. So how did you go from South Carolina to New York City?
I had been very fortunate in college that I had the opportunity to travel a good bit, both during certain semesters as well as in the summers for work. And one place that I did live for a summer was in New York City. I was focused more at that time on editorial writing and communications, but I loved New York, and that art school that I mentioned, I think also played a pretty big role, because with that sort of community, I knew a good bit of people who had also moved to the city. And so I had been very excited by my time in New York and felt curious about the opportunities here. There were a lot of small steps and maneuvers, I think, that got me on the path that I'm on. And I'm not sure how or if I would have been able to really do that in any other city or part of the country. And so for that, I'll always be grateful to New York and very much feel like it's my home for having had that initial introduction to what it really means to hustle here.
Yeah, I mean, it sounds like when you came here, you were really using your journalism and public health background in a really unique way and finding these perfect niche opportunities for yourself. Why did you decide to pursue your master's, and why CUNY?
Well, I decided to pursue the master's eventually because over those 7 years, it really became crystal clear to me that public health, and especially sexual health, was going to be my path. Once I knew that sexual health and public health was that path, I knew immediately that grad school would be a step that I would want to take. And I worked in direct services, so my day-to-day in public health was really interfacing with community, speaking with patients at a clinic about their health concerns, developing youth as peer educators, supervising them, talking with community directly at tabling events and organizing health fairs. And it's impossible when moving through that process not to come face to face with the broader policy and systematic challenges that exist. And I very much wanted to contribute to the effort of correcting and improving those systems. So I chose CUNY for several reasons. I really valued the engagement that I did have with the admissions staff. I found them to be extremely supportive and present as I had questions about the curriculum and deciding when I would matriculate based on a full-time work schedule, because I did throughout the 2 years program work full-time for the entire time. And I knew that I wouldn't have any choice but to do that and wanted to do that. And so it was very important to me that the school I chose could support that professional necessity. I also very much value public education, I have to say. It felt right to choose the city's public university to further a career that I really started in community in New York City, and really owe my entire path and career to New York City's communities. So I very much wanted to continue in that path. Another very important decision-making factor in choosing CUNY is that it is an incredibly affordable education while being a stellar education in both the conceptual areas of public health as well as being given the opportunity for practical experience. And it was top of mind for me not to make a decision that would place me in financial debt.
If you dream of making a difference in the world, a public health degree or certificate can give you the tools to do just that. The City University of New York's Graduate School of Public Health and Health Policy equips public health professionals to advance not only a healthier New York City, but a healthier world for us all. We want you to join us in our mission. Visit sph.cuny.edu to learn more about our programs. No matter where you are in your career, CUNY SPH offers a broad range of degree and certificate programs to not only help you advance in your career, but to have a real impact on the world. Public health professionals are needed now more than ever. Join us. Visit sph.cuny.edu to learn more.
So during your time at CUNY SPH, how did the pandemic alter your educational plans? Because it definitely upended a lot of people's plans and their journey. It changed a lot of people's journeys.
Yeah, absolutely it did. Because I was going to school and working full time, it was actually a facilitator of being able to move through some of the coursework and some of the academic responsibilities that I had more quickly, which is still a really odd thing to, I think, acknowledge sometimes. The
silver lining
privileges, I guess you call them, or silver lining, or just, that there were these kind of chaotic yet sometimes positive results of a changed world. My work in sexual health was extremely active through the city before the pandemic. And that was a huge shift for me because I no longer was teaching in classrooms. My clinics obviously shut down in schools. I started to supervise my peer education staff remotely. And then it also became clear that CUNY SPH would remain remote. I was able to stay in the program full time for the remainder of that program. And originally, I had thought that I would go remotely full time for the first semester, see how the second one went with a certain amount of coursework, and then possibly have to move to a part-time academic schedule as I completed the degree. So that change, it not only meant my being able to complete the degree faster, but it also meant that in some ways I was able to engage with the school and opportunities there more in depth and with more time available to me than I otherwise probably would have been.
So let's talk about some of those opportunities while you were here at CUNY SPH. I know you did some research on how people trust in vaccinations and the healthcare system. Can you tell us a bit about that research and what you found?
Yeah. So before I came on full time with Convince USA, which is directed by Scott Ratson, who's a professor at CUNY, both in the Chaz department and in the MS program, I was working on a study with him that was funded by the Commonwealth Fund. At the beginning of that study, I was working really as a research assistant as I was finishing the degree and still in my other role. And as I left to come on full time, I started to work more in a full time capacity on Commonwealth funded project as well. So that work is led by Scott Ratson and is also supported very heavily by Professor Chris Palmetto, as well as my colleague Lauren Rao, who is now the senior program manager of Convince USA. And in this work, we were really focusing on trust as a determinant in vaccine decision-making. And this was qualitative research that we were doing through in-depth interviews back last winter, as well as into the spring. And more recently, we've started to have some work published on the study in American Behavioral Scientists, and we're currently coding now for future submissions on the work as well. Lauren and I also published an op-ed in the Commonwealth Fund's blog about the interviews that we conducted. Mm-hmm. So we began by launching a national online survey, and we would recruit interview participants through that survey, and we would screen them for expressions of distrust or hesitancy to accept COVID-19 vaccination particularly. And we also were looking as well at other levels of distrust in healthcare systems and their personal experiences with either vaccination, healthcare, or possibly other prejudices. And so participants would discuss their experiences through the pandemic, their perception of COVID-19 vaccinations, talk about their healthcare decision-making processes, how they felt about other elements of vaccination, like mandates or their experiences with sick family members and things like that. And this is an area of research that we're continuing now as well with another research project at the school and under the Convince umbrella called the Strive Project, which is working to really extend the work that we began in that Commonwealth Fund project by understanding really the determinants of trust around vaccination.
That's really relevant and important right now. There's a lot of people who are still not vaccinated. Were there any themes or commonalities among people who chose not to get vaccinated?
Yeah, absolutely. One of the things that I like to share about this research that I think is so powerful is that many of the interviewees that we spoke with in this research still took the pandemic and the threat of COVID-19 incredibly seriously, even though for many of them, vaccination itself would prove to be a bridge too far. And so I think that was an incredibly important finding as we ultimately were looking to understand how to communicate about COVID-19 vaccination and offer guidance possibly about either communication, messaging, and strategies or policy about vaccination.
Mm-hmm. So what are some tangible steps for enhancing public trust in vaccination efforts?
There are absolutely tangible steps to be made either from a position of employers and workplace policy or broader policy and communications decision-making. Some of the recommendations that we have made in our published work have been to be very honest and transparent and consistent in messaging. Many of the respondents that we spoke to would describe an overwhelming or contradictory, often chaotic information environment. And so providing that consistent messaging is incredibly important to help people start to build trust, not just in the COVID-19 vaccines themselves, but also in broader public health systems, which is part of this effort, is to really understand how this research is relatable and applicable to building trust in public health beyond COVID-19 specifically or COVID-19 vaccination. We also, with regard to what workplaces and employers can do, some recommendations that we've made have been to make vaccination very easy and convenient for employees, to demonstrate understanding about if employees may feel unwell, and make sure that policies are prepared to support paid sick leave for those who do take time off to get vaccinated or to choose to get their children vaccinated. And then outside of the professional space, we have noted in some of our findings that peer-to-peer communication can consistently be shown to be an effective mode of changing behavior, setting up hotlines, door-to-door programs that allow people the space to communicate one-on-one. There's also an incredibly compelling and consistent finding that physicians are still the most trusted source for health information. Though some of that has eroded in the pandemic, it still is an incredibly important tool to make sure that health professionals feel equipped to not just answer questions, but to initiate conversations about COVID vaccination and to really drive that conversation. We could call this tactic sometimes motivational interviewing, where you're moving a person from their ambivalence to choice. Those are some of the strategies that we've offered via the papers that we've published so far.
And I was at an event that you put together about how to speak to loved ones about getting their vaccine against COVID-19. Were there any tips that you had for individuals, just peer-to-peer, talk to your friend about it, talk to your family member?
Yeah, absolutely. That event was organized with the Public Good Project's and Vocal New York as one of the efforts under our New York Vaccine Literacy campaign. And Joe Smizer is the CEO of Public Good Projects and speaks about these topics often as well. And he, I think, did a great job at that event of really highlighting strategies and tactics for speaking with family and friends. We also offer these tips in the Vaccine 101 module that we've developed under the VLC. And some of them are to ask open-ended questions and really be prepared for possible resistance. So not to push or attempt to be right, but to really try to listen to understand the fear or perspective of the other person before actually sharing information and correcting what you may understandably recognize as misinformation or a rumor, to really ask permission to share information about the vaccine before beginning to speak on it. I think it's important to help people to find their own reason for getting vaccinated, because for some people that might be really about protecting their family. For others, it might be about wanting to travel again. For others, it might be about wanting to sit at a restaurant or go visit their extended family at a reunion. And so really helping them to understand what their reason would be for getting vaccinated is incredibly helpful. And if you continue to notice that somebody in your life is sharing misinformation, either in a social setting or online, another recommendation we make to people is to engage them alone and privately, as opposed to engaging in any sort of public space, because those sorts of interactions often are found to really push a person to dig in and to double down on what it is that they are purporting to know. So looking for the right opportunity and moments to speak with a person are as important, if not more important, than what it is that you want to say to them.
Absolutely. I got a lot of great information out of that event. It was making me understand to be empathetic to people who have a difference of opinion and not to just go on social media and try to argue with them, because no one ever wins that situation.
Yeah, absolutely. Absolutely. There's a lot of overlap between that, I think, in the sex ed world that I come from too, in terms of how you can practice patience and the art really of holding space for another person to talk through their perspective. And really, people, I think, a lot of the time want to be heard and listened to. That was another finding that we saw consistently in our qualitative interviews, was that when we would ask people what they felt like systems or institutions should really be doing to value and respect the views of everybody, they would say, to paraphrase, they should be doing exactly what you're doing right now. Asking us what we think, trying to connect our opinions to our experiences, and not assuming that we are making these choices in a vacuum, or that any one source of information or post or otherwise has constructed their entire worldview. These are complex feelings rooted in life experience, historical experience, and often among people who value their own judgment and ability to discern what is safe and best for them and their families. And so if we're going to talk with them and try to guide them to a decision that aligns with those values, we have to recognize that they actually do hold those values.
Very, very important. And it sounds like you did a lot of really great work and a lot of great research while you were at CUNY SPH. How did the school prepare you for the workforce and provide opportunities beyond graduation?
I was so grateful for the opportunities I had at CUNY to work with professors and to engage in research. One of the first research projects that I worked on was actually through my fieldwork and master's essay, and I worked with Professor Heidi Jones as well as Diana Romero a bit on a systematic review of methodological uses and ethical considerations of public health data from Facebook posts and other Facebook sources. That was an incredible opportunity. It was the first time that I was writing for publication. So that in and of itself was just a massive eye-opener. And I really valued the guidance and mentorship of both Heidi and Diana. And I also was able through the coursework itself to really consistently connect certain health topics and subject areas to the work of any given course. So, for example, I initially fell into all of this vaccination and vaccine literacy work through an interest in HPV vaccination. I was in a course with Scott Ratson my very first semester.
Before COVID.
Yes, this would have been fall 2019. So
Yeah.
COVID did not even exist, let alone had made its way to America yet. And I was really interested in HPV vaccine research and wanting to understand the elements of how misinformation is proliferated there, because there's so many interesting elements of sociocultural explanations, and there's a major gender divide between uptake. And so I started to research that with Scott through papers on misinformation in the South and religious communities among HPV vaccination, as well as trying to promote that through, at the time, what was a blue legislature in Virginia, trying to understand how strengthening their vaccine mandate for HPV could be beneficial. And so from there, I really started to apply that health topic to other classes like measurement and evaluation or grant writing and things like that. And then when the pandemic came and I was apparently never to leave my desk or room again.
Felt like that for everyone.
I know. And so at that time, I got back in touch with Scott, who had launched Convince and was working on starting to convene both research and community efforts on COVID through the school. And I came on board to initially work with him and Lauren on a bibliography of vaccine literacy sources, as well as implementation and tactics for improving vaccine education. And so we were working to define vaccine literacy as well as put that bibliography together. And then from there, I started working as a research assistant on the Commonwealth project that I mentioned. And we wrote the grant to apply for the funding that facilitated the New York Vaccine Literacy Campaign that I now manage. All of that happened while I was a student.
That's great.
Yeah, I actually started the full-time position for the New York Vaccine Literacy Campaign and came on full-time under Convince and working on that research with about a month left of the degree, and then graduated in June. And I still haven't left my room.
So what is the New York Vaccine Literacy Campaign? How would you describe it?
Yeah, so the New York Vaccine Literacy Campaign is a community engagement and capacity building program that is intended really to lighten the load of direct service workers who have found themselves in the position of being asked to expertly advise their communities on both COVID-19, the virus, and COVID-19 vaccination. And so our job is to build community partnerships across the lower 9 counties of New York that support direct service workers in doing that work for their communities.
So how does your work with vaccine literacy connect to your background in sexual health education? You mentioned HPV vaccines, but I know it seems like a lot of things kind of connect for you.
Yeah, absolutely. Something I loved about working in sexual health is that there is so much crossover between various health issues. Of course, often your bread and butter is talking about pregnancy, birth control, abortion, things like that. But we regularly would also engage, in my case, young people and young adults on topics like HPV vaccination or other health issues that they were facing. Because I think ultimately, when you're in the position of working with community, you have to meet them where they are at. Whatever health issue is top of mind for them and is driving their decision making is what you have to get to the root of and understand so that you can support them. And we are doing that with the VLC and how we have been promoting vaccine literacy and COVID vaccination. The term often is called cross-messaging, where we're working with community partners who may primarily focus on maternal and child health or reproductive health or food insecurity or housing issues. And of course they are, because the pandemic is so new and they are not experts in COVID. So we have to find these kind of adjacent areas where we can look to see what are the strategies and that they already have in place for engaging community. What are the strengths of their relationships with community? What matters to those people? What do they want to know? And then we can provide the tools from there. And that structure felt very natural to me because of my work in sexual health. I also, for about a year, I guess, which is crazy to think, was a sexual health educator still during the pandemic. And I was a direct service worker who had classrooms of students that I had to teach through COVID as the world and the city had just shut down. And I had a staff of peer educators I was supervising, and I needed to support them in promoting social distancing, mask wearing, quarantining when exposed to COVID, and eventually in choosing vaccination. And that did come up for me in that role as vaccination became a possibility. So in January 2021, I was still a health educator. And I actually was one of, I guess, the first 2%, I think, of people in the country to get vaccinated as a union healthcare worker, and with it being not ever completely certain as to when and how we may have to work in person. I did that, and I was incredibly fortunate and grateful for the academic education as well as some of the workplace opportunities or professional development opportunities I'd had at CUNY to really leverage those skills and that knowledge to talk with the students that I had and the young people I managed and share with them why vaccination was a healthy choice for me. And, kind of anecdata, I guess you could say, that came back from them in many cases was that my explanation of choosing COVID vaccination and the breakdown of the science that I would provide them really supported their own choices eventually to not just choose to get vaccinated, but to trust the vaccine. So that approach is something that I've continued to take, not just with building community partnerships, but also with building the educational and communications materials that we make at the VLC in partnership with community leaders or direct service workers, and then promote.
So what are the future plans for the VLC?
Future plans for the VLC are that we're continuing right now to apply for additional funding. The community engagement element of this work was a 12-month grant, and the data visualization aspect of the work, which is led by Dr. Ashish Joshi at the school and manifests as a website called vaccineliteracycampaign.org, is an 18-month effort. And so the engagement piece will be completed in early May as of right now. And we seek funding not only to continue that work, but also to expand the work that we are doing to restoring adherence to routine immunization and leveraging the efforts that we've made so far in the partnerships we've built to increase vaccination among other health issues like HPV or flu, for example.
So how can others get involved with the New York Vaccine Literacy Campaign?
We are always looking for community partners. There is no ceiling to the number of partners that we can engage. If a community partner, and I say that quite broadly, if a partner could be not only a CBO or a faith-based organization, but also a school or really any setting that is working with community directly. We have a small team, but a very motivated team to engage partners in whatever ways interest them to both their and our capacity. So for a community partner, they may want to work with us to have us mount a webinar for them or offer a training to their staff on our COVID Vaccine 101 workshop, or possibly develop tailored materials and print collateral for the work that they're doing in community outreach. We also are starting to develop more capacity with the support of some fieldwork graduate students, as well as some part-time graduate students, to increase our efforts in developing social media materials for partners, or possibly blog writing, or even helping partners to apply to requests for proposals for funding if there are partners who want to increase the funding they're receiving for COVID vaccine efforts but would like support in guiding that application. Those are all things that we regularly help with. And we also work regularly, I should say as well, with the Harlem Health Initiative at the school, which is led by Deborah Levine and is just an incredible presence in the school and in the Harlem community. And so we work with her as well to make sure that we can support the partners that she has been building for even longer than the VLC has existed. So if a person listening is engaged with a community organization, please reach out. And for students who are listening, I would love to connect with anyone interested in the campaign. We do have an incredible group of grad students working with us now, and that all happened through outreach that I did and others at the school supported me in doing to promote positions. And we very much hope to be around after April. And if so, we'll need additional support.
What advice do you have for other students who are considering a career in public health?
For better or worse, I've really followed my passions in this area and have filled in the blanks with harder skills as needed. And it consistently has afforded me colleagues and students and patients and health topics and problems to solve that I really want to get out of bed in the morning for. And that, I think, is a gut check, understanding what not just you are passionate about, but the issues that really matter to you and that you want to fight for and that you want to spend all day talking about. My advice is to follow those gut feelings about the areas that you know you will continue to want to fight for and deepen your own knowledge in, and talk to as many professors and professional opportunity contacts and fellow students as absolutely possible, because reaching out and having those conversations and talking about not just what you want to do, but what you're unsure of, and asking others how they're either handling that decision if they're in the same place or have already been through the place that you're at, it is incredibly helpful. I think the last thing I would say as far as concrete advice would be, whatever room it is that you think you want to be in, do what you can to get into that room. Even if you're not completely sure that your skills fit the particular description of the application that would get you into that room, do what you can to be welcomed there, because we often underestimate how our life experiences and professional experiences do facilitate incredible success in the public health space, because so much of the work in public health is transferable and interrelated. Those skills matter, and I think it's important to take that chance on yourself and put yourself up for positions that excite you, even if you're not completely sure of what the outcome might look like.
Thanks for listening to Making Public Health Personal, presented by the CUNY Graduate School of Public Health and Health Policy in New York City. I want to give a special thanks to our guest today, Hannah Stuart Lathan, and let you know that all the links and resources we discussed in today's episode are available in the description below. To find out more about CUNY SPH and our programs, you can visit sph.cuny.edu or connect with us on social media. We're on LinkedIn, Twitter, Facebook, and YouTube. Just search CUNY SPH. You can now share, like, and subscribe to our show on Spotify, Apple Podcasts, Google Podcasts, and on our YouTube channel. This is your host, Laura Meoli-Ferrigon, signing off. And while public health has a global impact, that doesn't mean we can't make it personal.